Hi, good morning. My name is Jose Miranda Velasquez. This video is for BSN 225-21. This is the oral medication administration video. I'm in my Nightingale scrubs, and you can see my badge. I'll let you know that some of the packaging for these medications have already been opened. There's 2 pills in here that are broken. It's due to me practicing. And I'm using mouthwash as my oral medication. I'm going to start off by verifying my doctor's orders for this patient. Then I'm going to verify the 6 rights of medication administration. They are the right patient, the right medication, the right dose, the right route, the right time, and then the right documentation. After those 6, I will check my medication orders within the MAR, and I need to verify these 3 different times before administering any medication to any patient. This here's my first step in doing so. For this patient, I have 5 medications ordered that are found within MAR 1. They're daily 9 a.m. medications. The first is Docusate sodium. It's a 100 milligram tablet. The second one's warfarin. It's a 5 milligram tablet. The third is furosemide, a 20 milligram tablet. The fourth is potassium chloride, a 20 milliequivalent tablet. And then the fifth is a liquid medication. It's acetaminophen, 500 milligrams per milliliter. There are no dosage calculations needed for any of these medications. They're prepped and ready to go. So I'll grab them, and I'll make my way towards the patient's room. I'll knock, walk in, enter, and close the door behind me to ensure patient privacy and to avoid any HIPAA violations. Put my supplies down on a clean, flat, dry surface, perform hand hygiene, and introduce myself to the patient. Hi, my name is Jose. I'm one of the nurses here. Can I have you please state your name, your date of birth, and medical record number if you know it? At the same time, verify that with the patient's wristband. This counts as 2 patient identifiers. Okay, Mr. Miranda, do you have any allergies by chance? Or anything? Are you allergic to anything we're not aware of? No? Perfect, thank you. Okay, let me get situated. Allow me to look on my computer really quick, and I'll be with you in just a moment, okay? This is my second time verifying the medications within the MAR. Okay, at this point, I'll go ahead and perform hand hygiene again. Go ahead and put some gloves on, and we're going to go ahead and get started. Now that I'm at the patient bedside, I'm going to verify the medications a third and final time within the MAR. Before administering my medications, I need to make sure there are no pre-administration assessments needed. If they are needed, for Docusate sodium, I need to make sure they're not experiencing any vomiting or diarrhea. For warfarin, I need to make sure they're not showing any signs of excessive bruising or excessive bleeding. And no blood in their urine or stool, along with any cuts that won't stop. I want to monitor the lab values for PT and INR and to make sure they stay within normal range. For the third medication, furosemide, I want to check their blood pressure, their pulse, and their weight. For the fourth medication, potassium chloride, I need to check their blood pressure, their pulse, and possibly obtain an EKG depending on the situation. On the fifth one, the acetaminophen, I want to make sure they don't have any liver complications. If they do, I want to check and monitor their liver functions through testing to ensure they stay within normal range. It's not very common, but could happen if the patient's diabetic. I need to check their blood sugar before giving the acetaminophen, as they can cause slow false readings. Okay, now that I'm done with those, I'm going to move on with my patient. Okay, Mr. Miranda, I have your medications here. They are your daily 9 a.m. medications. You have 4 tablets and 1 liquid medication. Allow me to tell you what they do, along with what they are, and some side effects and adverse reactions. For side effects, it's typical to get them with most medications. We don't want this to happen. And if so, we don't want to prolong the side effect or have it get worse. If it does happen, please do let me know. For adverse reactions to any medications, they do require immediate medical attention. We don't want or expect this to happen either, but if they do, I will let your doctor know. Okay. You have 4 tablets. The first one is going to be sodium Docusate. This medication is a stool softener. It's given to prevent constipation. Some common side effects for this would be abdominal cramping. You may experience some nausea. Some adverse reactions may be facial swelling or rashes along your body. The second medication is warfarin. This medication is an anticoagulant which is given to prevent blood clots. Some side effects are that if you have any cuts or wounds on your body, they will take longer to clot and heal. When you brush your teeth, you may experience or notice some bleeding. Try to use a softer brush. Some adverse reactions for this medication would be coughing up blood as well as blood in your stool and urine. The third medication is furosemide. This medication is a diuretic, which helps get the excessive fluid out of the body. It may lower your blood pressure. Some common side effects are increased thirst, maybe a slight headache. Adverse reaction may be muscle cramping or weakness, which could be a possible electrolyte imbalance. So please let me know if that does happen. Your fourth medication is potassium chloride. This is a supplement to ensure that your potassium levels don't drop down low. Some side effects are feeling a little gassy, possibly an upset stomach. An adverse reaction could be weakness or heart palpitations. Again, let me know if this happens. For your fifth medication, acetaminophen, this is an analgesic which helps helps treat fevers and pain. Some side effects may be nausea, slight loss of appetite. Some adverse reactions would be a rash on the body and extreme abdominal pain. Any of these adverse reactions occur, please do let me know. Mr. Miranda, do you have any questions for me? No? Perfect. Allow me to get your tablets ready. Okay, first I'm going to have to sit you up a little bit more in the bed. That is perfect there. Are you comfortable? Okay. Mr. Miranda is sitting upright. For your tablets, do you want to take them all at once or one by one? All together? Perfect. I'm going to place the medicine cup here, okay? Here you go. Here's some water. Go ahead and take those and drink some water. Perfect. Are you okay? Okay, good. Here's your liquid medication. Give me a second so I can prepare this. For the liquid medication, I need to make sure that I shake the bottle for an appropriate amount of time. I want to make sure that I hold the label in the palm of my hand so I can protect it. And then when I remove the lid, I need to allow it to sit upward. When I begin to pour the medication, I need to ensure that it's on a flat surface, and I need to pour the 15 milliliters. And I need to ensure that nothing touches the rim of the cup. When I am done pouring, I will get a clean tissue and wipe the edge of the rim, but not the top. Once I'm done, I will dispose of the cup and put the lid back on. Then I will place my bottle on the side. Okay. Label. Lid is upside up. Grabbing a hold of the label. Gonna pour 15 milliliters. Grab my tissue. Clean the edge, discard that. Take my lid, place that back on. Show the camera. Got 15 milliliters. Okay, Mr. Miranda, I have your liquid medication. Are you ready to take it? Good. Here it is. Here's some water to follow. Okay, Mr. Miranda, how do you feel? Okay. Okay, I'm gonna have you remain a little upright for a little bit, and I will come back to check on you in a moment. In the meantime, I will clean my area. Come back and check on Mr. Miranda. Mr. Miranda, are you comfortable? Okay, good. My patient has stated that he is comfortable. Would you like to be laid back down or remain upright? Okay, remain upright. So my patient is comfortable. He's in the proper position. We'll bring the call light near him. At this point, I will remove my gloves and dispose of them. Perform hand hygiene. Take the medication back with me to the med room and then document my results. Thank you very much.